a doctor, an OBGYN to be exact. And in true doctor fashion, I am going to take approximately 10 minutes to diagnose you with a condition you've probably never heard of, but whose symptoms you will recognize instantly. But first, some background. Up until 2 years ago, my work consisted of caring for women throughout their life cycle, from their first period, through their first pregnancy, through menopause and beyond. And there is nothing like confirming someone's first pregnancy for the very first time, as you point out the little gummy bear-like image on the ultrasound machine with the tiniest flicker of a heartbeat. I mean, the excitement in the room is palpable. Or seeing a postmenopausal patient for their first follow-up appointment after finally getting treated for their symptoms. It is such incredibly important, fulfilling work. Also, there were a lot of not safe for work, but safe for my work moments, like teaching a woman well into her 60s who had never had an orgasm how to perform clitoral stimulation. Every day, I got to have intimate conversations with women about their hopes, fears, and concerns for the future. Sometimes I was a doctor. Others, I was a therapist. And more often than not, I was just an ear to listen, which was probably my most favorite part. Now, with all of that, it sounds amazing, and it was really amazing, but there were some really heart-crushing moments too. I remember the first time I was on call, and I had to tell this woman that her highly desired IVF pregnancy had miscarried. And I cried. She cried, I cried, we cried together. It is so hard to allow yourself to hope after a pregnancy loss, especially when the voice inside your head is telling you that it is somehow your fault and that you somehow deserved it. And seeing my patients experience pregnancy losses, sometimes multiple, sometimes late in pregnancy, that was heart-crushing. GYN had its moments too. Having to tell someone that their worst fear has been realized and that the bleeding they've been experiencing is cancer. It's a conversation that I have never fully mastered. In addition, a lot of my patients were dealing with anxiety and self-doubt, and it somehow manifested into their physical experience. So trying to convince someone that their vagina smells perfect, just as it is, despite the litany of products whose marketing says otherwise, can be a real battle. I've said it before, and I will say it again. Vaginas should not smell like fruit. They should not smell like flowers, and they should not smell like tropical destinations. Or try convincing someone that symmetry within the human body does not exist. Similar to our labia, no two breasts are exactly the same size. No size is best, and they are all different. Did I mention that I was also a therapist? And any good therapist knows that your primary task is to listen. As I listened to my patients, there was often one common thread. In some way, shape, or form, you, are dealing with disallowance. Now, disallowance is a legal term. It means denial. But for the sake of this talk, disallowance is the condition of denying yourself or holding yourself back from obtaining or accomplishing something that you truly desire. So here's how disallowance works. You have an idea, a thought, a dream, something that you would really like to come into fruition. But instead of taking that first step and acting on it, you stop yourself and you tell yourself how it's not achievable for anyone or just you. We are very good at arguing for our own limitations. or you find some reason not to take care of your needs in the present moment, or not to enjoy yourself just as you are, denying yourself of the inner peace and satisfaction that you are so worthy of. Does that sound familiar? By stressing about their vaginal smells, my patients were preventing themselves from enjoying and fully engaging their sexual health. By perseverating about that newfound bulge in their lower abdomen, a postpartum visitor that had overstayed its welcome. They were preventing themselves from enjoying a body that had metamorphosized into something stronger and more enduring. By continuously downplaying their own healthcare needs due to past experiences where those needs weren't validated, or by constantly downplaying their needs to prioritize the needs of others, they were preventing themselves from having the amazing quality of life they deserved. Now, despite my keen observation skills, my own aha moment had yet to come, but it was well on its way. In March of 2020, as the world began to shut down, my otherwise busy office began to shut down as well. And like you, I had a lot of time to think in the quiet. At the time, I was 20 weeks pregnant with my second child. That was a pregnancy hard fought, coming after back-to-back miscarriages. And so I sat in my office on that day calling other pregnant women, calling them because we were trying to postpone their visits, delay them, to protect them and their unborn babies. And as I called pregnant patient after pregnant patient, and I'm looking down at my own growing belly, and the cognitive dissonance just became too much. You know, how could I take an oath to protect others when I couldn't protect my own baby? And a seed had been planted. As I returned from maternity leave, I watched as my colleagues and I, people who were incredibly devoted to the health of others, often neglected and sometimes abused our own mental, spiritual, and physical health. As I made my first appointment with my therapist, the first of many, I thought to myself, this is not healing. This is not healthy. I am not healthy. And then it hit me. I too was dealing with disallowance. I have always desired a career in women's education and women's empowerment, but my original goal, my original dream, was not to become a doctor at all. My original dream was to have a show where I talked about women's health issues. That's all. But at just 17 years old, a time when I cared more about others' perceptions of me than I did about truly understanding myself, I first experienced disallowance. In her book, Mindset, The New Psychology of Success, Stanford psychologist Carol Dweck notes how in grade school, young girls are often regularly praised for being perfect. The end result is girls learn to avoid taking risks. They learn to avoid making mistakes. We learn to be perfect. Perfectionism for me led to multiple degrees, years of grueling clinical training, followed by years in an incredibly fulfilling yet stressful clinical practice. In my quest for perfectionism, I was never enough. And so I sat there in my office that fateful day in March of 2020, a fully realized physician in full-fledged disallowance, no closer to realizing my dream than I had been 20 years prior. So, since that moment 3.5 years ago, I can say that I have undergone a serious amount of personal and professional development. And I can confidently say that I have found the cure for disallowance. The cure for disallowance is permission. So, how do you grant yourself permission? Well, I had been managing my own disallowance for so long that it had become my preference. Like the feeling of denying myself felt so good. It felt good. It felt natural. It was just so familiar to me. So I needed to take drastic measures. And I left my full-time clinical practice. Some might call that insanity, and some did, in fact. But I call it a journey. I started a health platform for women and people assigned female at birth who feel unseen and unheard in the medical space. And with that, I launched a podcast that has over 60 episodes to date. I finally have my show. And I wish that I could tell you that treating my own disallowance has been an easy path. It has not. But I get to discuss the topics I want, centering people whose needs are far too often neglected in the medical space and uncovering multiple pathways to healing. There are ups and there are downs, but in giving myself permission to try, I granted myself permission to fail. And that is the greatest permission of all. Now that I have centered my dream, I am slowly adding back the other pieces of my career. Will I go into full-time clinical practice again? I don't know. I granted myself permission to let it go and explore new ventures. And that is the thing about permission. Everything is possible. Now for the prescription. It's what you've been waiting for. Here are 3 simple steps to get you started. The 3 R's, simple to remember. Number 1, recognize. Recognize where you are dealing with disallowance in your life. Here's a hint, start anywhere that makes you feel bad. So if you look in the mirror and you constantly have to pinch your skin or twist your body like a contortionist to feel good, or you scroll through social media and you see someone who is doing that exact same thing that you have been wanting to do for months or maybe even years. And instead of feeling inspired to action, you feel bad. My friends, you are dealing with disallowance. And then you need to take step number 2, release. Once you have identified the disallowance, release it. Thoughts like, I can't have wrinkles, cellulite, or rolls to be beautiful. Or thoughts like, I'll never be successful if I try to do that. Release those thoughts and don't look back. And then number 3, replace. You were born knowing that you are worthy, you are beautiful, and life has endless possibilities. Release those limiting beliefs and replace them with ones that serve you. Every curve and angle on my body is beautiful, and my beauty does not define me. Or every effort I make brings me one step closer to my goal, and I am confident in my ability to succeed. If you are disallowing yourself from asking for what you want, grant yourself permission to ask for that raise, for that promotion, for that loan to start your new business. If you are disallowing yourself from trying something new, grant yourself permission to evolve. Take that new position, leave that relationship, start a dance class, start therapy. That's a good start. If you are disallowing yourself from caring for your sexual health, grant yourself permission to seek pleasure. Buy the vibrator and use it. Doctor's orders. Grant yourself permission to fail. Grant yourself permission to tell your story. Grant yourself permission to say yes, to say no, to stay, to go, to seek that second opinion, to question what you've been told. So if I can leave you with just one takeaway, something I wish someone would have told me when I was that 17-year-old girl, you are the only one with the power to grant yourself permission. Don't be the one to hold yourself back. Thank you.